This video was brought to you by Audible. By using the link in the description, you can get 1 month's free membership, including a free audiobook of your choice, and unlimited access to Audible's original podcasts, including the brilliant Sun King about the rise of Rupert Murdoch. Sign up and support the channel by clicking the link in the description. Hello and welcome to another TLDR Explains video. In this one, we're going to be taking a look at President Trump's decision to suspend funding for the World Health Organization and try and figure out whether or not his comments and complaints are justified. To be honest, it doesn't just seem that Trump has an issue with them, because whenever we do a video that mentions the World Health Organization, we get a ton of comments saying that they're not reliable. And because we thought that was an interesting phenomenon, we thought we might as well make a video on it. So before we get to Trump's specific criticisms of the World Health Organization, just give us a second to explain what the WHO is for those who don't yet have an opinion on it. The WHO, or World Health Organization, is one of 15 United Nations agencies. Its headquarters are based in Geneva, and according to the WHO Constitution, its main objective is the attainment by all peoples of the highest possible level of health. Its supreme governing body is the WHO Executive Board, which is composed of 34 medical experts. There are 7 representing Africa, 6 representing the Americas, 5 representing the Eastern Mediterranean, 8 representing Europe, 3 representing Southeast Asia, and 5 representing the Western Pacific. This executive body is basically the part of the UN that helps out when there's some sort of medical emergency, like the coronavirus pandemic. Anyway, what is Trump's issue with it? Well, he thinks that they've mishandled the coronavirus crisis. He put out a tweet on April 7th saying that the WHO really blew it, for some reason funded largely by the United States, yet very China-centric. The next day, at a press conference, Trump reiterated his complaint and claimed that they could have called it months earlier, and has subsequently said that he's freezing funding to the WHO. Trump seems to have 3 specific complaints or comments. 1, that the US pays a lot into the WHO's budget. 2, that the WHO was too late with its warnings about the coronavirus. And 3, that the WHO has a China bias. Starting with the first one, Trump is completely right here. The WHO works on a 2-year budget cycle. The 2018-19 cycle's total budget was about $5.6 billion. Around 20% of this is from assessed contributions, which are mandatory payments from UN members. Of this, the US paid $275 million, whereas China only paid $75 million. The remaining 80% of the WHO's funding actually comes from voluntary contributions. China only paid about $10 million in voluntary contributions over the 2018-19 cycle, whereas the US paid about $650 million. Which means that the US accounted for nearly 15% of all WHO funding over that cycle. Although it is worth noting that Trump already proposed cutting the annual assessed contributions by about 50% in his budget proposals for the fiscal year of 2021. China claims that it does most of its voluntary health aid unilaterally, preferring to go through its own channels rather than the WHO, as they did do for the Ebola crisis. But Trump is right to point out that the US pays about 10 times more than China does into the WHO, and more than any other country. Anyway, what about Trump's second claim, that the World Health Organization acted too slowly in reaction to this crisis? Just to give you the facts, the World Health Organization declared the coronavirus a public health emergency of international concern, the highest level of alarm short of a pandemic, on January 30th, when there were about 10,000 cases worldwide. They then went on to declare it as a pandemic on March 11th, when there were about 126,000 cases worldwide. Another moment that's regularly highlighted by those criticising the WHO is the January 14th tweet where the organisation said that there was no clear evidence of human-to-human transmission. However, even at this time, the WHO was warning in technical and press briefings that human-to-human transmission was a strong possibility and did encourage suitable precautions. So while they did say that there was no clear evidence at that time, they were making it very clear that this was subject to change, and new evidence was likely to emerge. It's hard to say whether this is too late or not, but for reference, the WHO declared swine flu as a public health emergency of international concern in late April of 2019, before there had been any recorded deaths, and declared a pandemic in June, when the CDC estimated that there had been about 1 million cases in the US alone. More recently, it declared Ebola a public health emergency of international concern on the 8th of August 2014, 5 months after the first recorded case, by which point there have been 1,711 cases and 932 deaths. Again, we're not epidemiologists, and we're not particularly well placed to say whether they were too late or not on this case. But there are 3 things that should be said in the WHO's defence. Firstly, the speed at which countries respond to pandemics is largely up to them. The World Health Organization might have been slow, but the world was aware of coronavirus and its capacity for human-to-human transmission as early as January 23rd, and the WHO apparently sent out technical advice to its member states, warning them about this as early as January 11th. It's up to the member states to be proactive, not the WHO. As we talked about in another video, South Korea started mass tracking as early as January and successfully contained the virus. South Korea and the US had the same advice from the WHO, so it's unfair to blame the severity of the crisis solely on the World Health Organization. This isn't to say they necessarily did a good job, just that the member states also have to take some responsibility, and Trump was more complacent than most. To give you a quick timeline, on January 30th, Trump described the US Health Secretary as alarmist, insisting that there are only 5 cases in the US and all of them were recovering. On February 24th, he tweeted that everything was very much under control, and on February 26th, he described those warning about the virus as fake news, and on the same day said that when you have 15 people and the 15 within a couple of days is going to be 0, that's a pretty good job we've done. 2 days later, he said that it's going to disappear. One day, it's like a miracle, it will disappear. On March 7th, he made the scientifically inaccurate comparison between the flu and COVID-19, downplaying the severity of the virus. On the 12th, the day after it was declared a pandemic, he continued to downplay the situation, saying that it's going to go away. Then, 6 days after the World Health Organization declared it a pandemic, Trump stated, "I've always known this was real. This is a pandemic. I felt that it was a pandemic long before it was called a pandemic." So, while there's a real case to be made that the World Health Organization were too slow to act, the countries that followed their guidance, like South Korea, have been able to mitigate the worst effects of the virus. Secondly, the WHO seems to be in a lose-lose situation. If the virus is well contained and the damage is limited, then people say they called it too early and ruined the economy unnecessarily. This was the criticism levelled against them after the swine flu pandemic, once everyone realised that swine flu was about as fatal as the bog standard flu, even though the WHO does estimate that nearly 300,000 people died of swine flu worldwide. In fact, this might go some way to explain why they were slower in declaring an emergency this time round, because they got so much flack last time for being too hasty. The problem is for them, that if it turns into a crisis like the one we're having at the moment, everyone will say that they ended up calling it too late. Thirdly, the WHO certainly wasn't helped by China. We'll get into this in more detail in a moment, but China wasn't 100% transparent when it comes to the virus, and this has made the WHO's job a whole lot harder. China did downplay the severity of the coronavirus early on, and did so for political reasons, and that left the WHO in a difficult position, where they kind of had to take China's data at face value. Basically, if the WHO was slow to respond to the crisis, it is in part because China partially covered it up early on. Which leads us nicely onto Trump's third claim. The WHO is biased towards China. China hasn't behaved particularly well during the coronavirus crisis. To give you a quick timeline, China had its first cases in late December. By early January, Wuhan doctors were warning other medical professionals via WeChat that there was a new flu-like virus. These doctors were warned by Chinese authorities of illegal activity of publishing false information online on January 3rd. Despite the virus appearing in medical professionals as late as January 20th, China maintained that there was no human-to-human transmission. To put this in context, Chinese doctors were warning about human-to-human contact at the beginning of January, and Taiwan claimed that it warned the World Health Organization of human-to-human transmission as early as late December. This doesn't necessarily prove that China was deliberately downplaying the severity of the virus, and it could be an honest mistake in their tracing, but it doesn't look good. Even worse, China denied the WHO access to Hubei province in mid-January, when it wanted to send a team of their own scientific advisors over. Had the world known that the coronavirus was infectious a month earlier, we might not be in this mess at all. As I'm sure all of you armchair epidemiologists know by now, a month is a very long time in epidemiological terms. Anyway, the WHO took the Chinese data at face value and reported it back to the world. Is this symptomatic of pro-Chinese bias? Well, it's hard to say, but probably not. The WHO can't do much more than report the information that comes in from member states, and it's not their fault if the data's rubbish. You might be asking why the WHO didn't heed Taiwan's warning in late December when they said that human-to-human transmission might be possible. But this is because Taiwan isn't technically a member of the WHO, and the Chinese government have been pressuring the WHO and the UN more generally to not include the Taiwan as an independent state for years, and the UN had acceded. And this is why the WHO listened to China and not Taiwan. Again, it's hard to tell whether or not the UN's submissiveness to China on Taiwan is symptomatic of pro-Chinese bias, or whether it's just political pragmatism. It could either be the UN sucking up to China, or just giving them some ground to keep China on side and keep them cooperative. Same thing with the WHO's comments about China. On January 30th, the WHO's Director General was pretty gushing in his praise of China. Again, this could be pro-China bias, but it could also be political pragmatism. You'd have to be able to read his mind to know for sure. Anyway, the long and short of this all is that Trump is right to say that the US pays a lot of money to the WHO, but it's hard to say with any certainty whether or not the WHO acted too slowly, or whether or not it has a pro-China bias. And even if both those things were true, that wouldn't change the fact that Trump and the US have to take some responsibility for the way that they've handled the coronavirus. As I said at the start, this video was brought to you by Audible. Audible is the #1 source for getting audiobooks online, with over 200,000 books available. If you sign up, you can get one free book every month, and if you don't like the book you choose, then it's all good, you can just swap it out for another. As well as your free book every month, you also get access to as many Audible original podcasts as you could possibly want. And also, if you cancel your membership, no worries. Those books you've downloaded are yours to keep. Get your 1 month free trial and your free book on us by clicking the link in the description. And by doing so, you'll let them know that you came from us, which helps us out too. We'll keep you updated on the coronavirus as events unfold, so be sure to subscribe to the channel and hit the bell icon to be notified every time we release a video. Special thanks to our Patreon backers who make videos like this one possible.